Hello and welcome to the CGT 2020 Employee Benefits webinar. Over about the next 15 minutes, we're going to walk through all the different coverages that are listed here on page 1, medical, dental, vision, life insurance, and disability. Before we do, please be mindful that the open enrollment period is the 21st of November through the 1st of December, and what you pick during open enrollment sticks for 1 year unless you have one of these qualifying life events, which would be reasons that the IRS tells us that we can change whatever you choose during open enrollment in the middle of the year. We are staying with Blue Cross Blue Shield again this year. We changed the plan designs a little bit, and that's because we got rid of the HMO plan that was the least expensive option in the past, and we made a couple of plan design changes. We have the good plan, the buy-up plan, and the low deductible plan. The good plan has co-pays for office visit and primary care and specialist visits, as does the buy-up plan, as does the low deductible health plan. All of these plans include preventative services at 100%. We'll touch on that before the end of the webinar. They all have $30 or $35 copays for a virtual visit, which is 24/7, 365 access to a doctor on your phone. The deductibles are different on each plan. This one is not $15,000, it's $1,500. This one is $1,000. And this one is $500. So the deductible is the highest here. Again, this is $1,500, $1,000 here, $500 there. Coinsurance is sharing after you hit your deductible, and you share in cost. You only pay 20% of the bills, depending on which plan you're on, the good plan or the buy-up option. On the low deductible health plan, once you hit your deductible and out-of-pocket max, you're done. Now, what you'll see on the bottom, speaking of out-of-pocket max, these numbers represent on an individual basis your worst case scenario for covered in-network services in any 12-month period of time, January through December. So that's the worst case scenario. So you first meet your deductible, you share in some costs after your deductible, and then you have your out-of-pocket maximum. Once you hit the out-of-pocket max, the insurance company picks up the tab. You have copays depending on where you buy the drug for preferred and non-preferred. The biggest retailer that is not in the Blue Cross Blue Shield network is CVS. And so please be mindful of where you buy your prescription drugs. You've got copays of $75 if you go to the urgent care facility. And we'll talk about some smart ways to spend your money wisely. Now, the thing that you want to know most is probably, what is this going to cost me? So the good plan is actually less expensive than it was last year. Still $0 for employee-only coverage on this good plan. And it increases in cost as you add more people. The buy-up plan is more expensive, but the plan is similar to the middle plan that we had last year, and costs are almost the exact same on the buy-up plan. So not a whole lot of movement there. The low deductible health plan is obviously the most expensive, because it's got the lowest deductible and out-of-pocket maximum. So we wanted to give you 3 different choices to be able to choose from and make sure that you have access to great coverage through Blue Cross Blue Shield. I referenced a couple of these boxes here on this page a little bit earlier. Virtual visits, 24/7, 365. You can also go to the doctor's office. You can go to an urgent care clinic, like a retail health clinic or an urgent care provider. Always be mindful that freestanding emergency rooms are popping up all over the place. It's an emergency room, not in a hospital. If you walk into an ER, but you thought you were walking into an urgent care provider, it's going to be a lot more expensive. These next couple of pages are a listing of some of the preventative services that are covered for free to you on the plan with Blue Cross Blue Shield, no matter which plan you're on. This page details a website that you can go to look for in-network providers. As a reminder, download the BCBSTX app. You can track in-network providers, where you are in your deductible, your out-of-pocket max. You can have your ID card just on your phone. We talked about virtual visits a little bit. This is more information on that. Here are some reasons why you would call the virtual care doctor. Again, 24/7, 365. You can call them on the phone, or you can log in through your computer. The dental carrier stayed the exact same, the dental plan stayed the exact same, and the dental cost stayed the exact same as it did last year. Every individual who's covered gets $1,500 a year that Principal will apply towards covered expenses. The preventative services are $0 to you, but if, for example, you go in and the dentist is asking you to do a deep cleaning, that would be outside of a preventative service. There would be a little bit of a cost there, but part of this $1,500 would be applied towards the cost of that deep cleaning, just as an example. Vision is the same as it was last year, and the cost is the same as it was last year, and the carrier is the same as it was last year. So same. $150 for frames. Lenses are on a copay, but if you're really blind, like me, you're probably not getting out just for a copay. Or you can have $150 for contact lenses. This once every business means you can't get glasses and contacts covered by Principal at the exact same time. It's one or the other. Costs are at the bottom of page 12 here. And we're going to talk about basic life insurance. So this is free to you, which is great news. Everybody gets $25,000. Make sure that when you go online to Paycom, that your beneficiary is the person you want it to be. That's where the proceeds of the life insurance go if you are no longer living. This page is a pretty busy page. What this means is more life insurance than the free stuff that CGT pays for you. Voluntary life, accidental death, and dismemberment is more life insurance. What you'll be able to do when you go online is you'll be able to plug in a benefit amount that you would like, and it will tie to your age, and then it will ask you for an application. So that's called evidence of insurability. And just as a reminder, if you apply for life insurance but don't finish the application process, then the insurance isn't there. So you have to pay attention to that evidence of insurability. It'll come in the mail, or you can drag it down off of Paycom and be able to fill that out. These rates are just the rates depending on the benefit amount broken out, by age. But you'll also be able to see all those same things online. Now, disability insurance works like this. It protects a portion of your income. So if I made $1 a year, 60 cents of my dollar would be protected in an insurance policy by Principal. If, God forbid, I can't come back to work in any capacity, then my income is protected to 25. If I can, then this line called own occupation period applies. So it would be between me and the insurance company to determine what job I can do and then how much the insurance payment would be, because I would be earning income again by going back to work, which is a good thing. You'll be able to look at the cost for this to see if you want it or not online as well. And we always look at short-term disability at CGT. It was too expensive to be able to do this year, but it's always something that we're going to continue to look at. If you'd like to do a little bit of math on long-term disability, then you can do that, but you can also go online. Two things here. EAP is free to you. Travel Assist is free to you. EAP is listed out here. This should be page 20 of why you should care about it and what it does. Travel Assist is on page 21 and 22 of what it offers you. And a lot of times it's just a function of remembering what's there. So take a look at 20 and 21 for more information on the EAP and on Travel Assist. The rest of the information I'm going to scroll through very, very quickly. Might be a little visually disorienting as I'm going through this pretty quick. So close your eyes, or if you open them, know that you might get a little dizzy. These are all required notices we won't cover for the sake of time. Leslie is the primary point of contact, and Vanessa in our San Antonio office backs her and the rest of the HR ninjas up with any questions that you have throughout the year. And then we've got a glossary of terms just in case you are interested to know more about insurance. Overall, this year was it was an expensive year for CGT. They came out of pocket hundreds of thousands of dollars, because the good news is we're using the plan. The bad news is there was a big increase on the table, and CGT really came to the table to pay for a majority of that and passed relatively little on to the employee. So that's very good news. Everything else remained the same. Thanks for joining us, and let us know if you have any questions.